Welcome back. I'm joined this morning with Mercy Joplin, Dr. Victoria Shirley. Thank you so much for joining us this morning.
Thank you very much for having me.
So I know today we're going to talk about an issue that is maybe not the most popular to talk about, but is a very real health issue that a lot of people do experience.
Very true, and it's urinary incontinence. And as an OBGYN, I see mostly females, and it's something that is very common in women of all ages, but we tend to see it most often in women of middle age or older age as they're starting to go through the change of life and estrogen is starting to decrease.
Can you tell us a little bit about, what urinary incontinence is for those who may not know?
So urinary incontinence is where a person has leakage of urine when they don't want to be urinating. So it can happen in many different situations. There's actually 3 types of urinary incontinence that I see. The first one's called stress urinary incontinence, and that's leaking urine when you cough or sneeze or laugh, or sometimes I hear of moms jumping on the trampoline with their kids and they're like, oh, I'm leaking, I can't do this anymore. And then the second type of urinary incontinence is called urge incontinence. And that's the type of leaking of urine when you feel like your bladder's full, like you need to go to the restroom, and you're getting ready to go to the restroom, but then your bladder just leaks before you even make it to the restroom. And then the third one is mixed urinary incontinence, and that's a little bit of a combination of both of those, of the stress and the urge incontinence.
So is there, certain ways that you're able to help diagnose this for women?
Yes. So probably the most important thing that we do is do a good history and physical. And what does that mean? That means that I'm sitting down with a patient and asking them about their medical history. Do they have any chronic illnesses like diabetes or high blood pressure, or how many pregnancies have they had? Did they have difficult deliveries? Did they have to have forceps or vacuum to help get the baby out? What kind of medications are they taking? Because there are certain types of medications that can make that worse as well. And so we go through and ask all of these questions, and then we do a thorough exam. And usually we do a pelvic exam. We're looking at the pelvic floor musculature. We're looking at the vaginal mucosa, make sure there's not any what we call prolapse, where the vaginal mucosa starts to drop down and can cause problems with bladder leaking.
Amazing. I know a lot of times, when we hear women sometimes talk about this, it's always something that they almost say that, they're just used to it. They just deal with it. It's a part of life. It's what happens. But are there treatments for this, that they should talk to their doctor with?
Yes, there absolutely are treatments. We may not get 100% cure of urinary incontinence, but we can sure make it a whole lot better for them. And so some of those treatments are medications where all they need to do is take a medicine, and that can help manage the incontinence. Sometimes it's pelvic floor physical therapy. So we work with our physical therapists. We have some that specialize in the pelvic floor musculature to help reduce the incontinence. And then there's surgical options as well, where we can do surgery to help repair some of those things that can happen that can cause the urinary incontinence.
Yeah. And at what point should a woman maybe consider reaching out to their doctor, say, maybe this is something I should seek help with or have checked out?
They should ask anytime. If they're having problems with incontinence, they should talk to their doctor about it, because there may be just simple things, just like doing Kegel exercises or talking to a physical therapist to help reduce their risk of leaking or help their leaking problems. They can, doctors should be asking about that too. Like when I do a woman exam, I'm asking women, hey, are you having any problems down here with like urinary leakage? And they can tell me yes or no. And then we can talk about, the different treatments that are involved.
Well, thank you so much. This seems like very important information, and I'm hoping people at home are listening in it and, taking that to mind and maybe reaching out now.
Oh, I think that would be great. Thank you so much for having me.
Well, thank you so much for joining us, Dr. Shirley. We'll be right back.
All right, thank you.